What can a caregiver do if they're faced with an aggressive resident? Let's find out on JoJo, the Caregiver Show. Hi, folks. Now, what can we do whenever we are faced with the type of resident that shows aggressive behavior and maybe showing aggression towards yourself? So the first thing to remember is you're there to observe and report on your client's changes in behavior. Changes in behavior for one of your clients that is showing anxiety would be things like wandering around the nursing home when usually they don't, exit seeking from the nursing home when usually they don't, and then other things you should look for, such as their facial expressions, any type of hand wringing. These are the types of common behaviors that are associated with an anxiety episode. So if your resident is having an anxiety episode, you want to make sure that you're aware of your approach towards your client. So your approach should be in a calm manner. You should always have your palms open so your client can see them. And also very important, make sure you're at least 3 feet away from your client. This is what we call personal space, the 3-foot diameter around your client. So it's important for you to stand outside of that 3-foot circle. Now, how you stand is just as important. You should not stand facing your client. You should turn your body into a sideways position, or what we call a 45-degree angle. You should always approach your aggressive clients in this manner. And if you stand in that 45-degree angle, it's much harder for them to try and strike you or grab you if you're in that position. Also, very easy for you to get out of a difficult situation if you're in that 45-degree angle standing position. So remember that whenever you're faced with an aggressive client. Now, you are going to be supportive. Your communication is also important. Always communicate in a calm manner. Monotone is usually best. You don't want your volume to go up and down. You want your volume for the appropriate space in between you and your client. Being supportive like this, sometimes it's going to be enough to calm your client down. Sometimes it is not. So if your client does start to escalate, usually it's going to take the form of verbal escalation. Verbal escalation just means your client is going to become more difficult, refusing what you want them to do. Sometimes this can even lead to yelling, screaming, swearing, sometimes even intimidation or threats. This type of situation you want to try and take control of. You want to kind of use 2 different techniques, and those techniques are redirection and setting limits. So for example, if your client is Mr. Jones, let's go down for breakfast now. After breakfast, Mr. Jones, I'm going to take you for a walk in the garden because I know how much you like the flowers in the garden. So let's go down for breakfast now, Mr. Jones. Mr. Jones, if you come for dinner, after dinner, I'm going to take you to movie night. I know how much you love movies. Let's go down to dinner now, Mr. Jones. Kind of redirection. Plus you're setting positive limits. Positive limits means it's a positive situation for your client, something for them to look forward to, something for them to have the excuse to actually listen to you, right? That's what you're trying to do with redirection and setting positive limits. Sometimes this is going to work for you. Sometimes it will not work. If it does escalate past verbal escalation, your client may have an acting out episode where your client is going to either try to strike you or he's going to try to grab you. So if he tries to strike you, he's going to try to hit you or kick you. If your client tries to kick you, very easy. You just have to turn your foot up to a 45-degree angle. Remember, you're already in that sideways standing position, so your foot would be forward like this. Just turn it on an angle. Your client will then kick the bottom of your foot, or your foot can move around, so he does kick the bottom of your foot and not your leg. If your client tries to hit you, very easy to block. You just raise your arm up like so, and your client will hit one of the bones in your forearm, cause very minimal pain to yourself, and you're also blocking your client from hitting any areas of your face or your body. So that's if your client tries a strike. Now, if your client tries to grab you, usually they're going to grab your arm. And what you do in this situation is you're going to kind of look for the weak point of this grab. So you see my hand, it would be very difficult for me to go in this direction. You always want to try and move towards the finger and thumb direction of your client's grab. So you see right now, the weakest point of this grab is in between my finger and my thumb. So that's the direction you're going to pull out of the grab, because that's the weakest point of your client's grab. So always pull in that direction between the finger and the thumb. If you think he has too tight of grip, you can actually lean towards your client first, and that will loosen his grip even more, and then pull out between the finger and the thumb. So that's if your client grabs you. All those situations, you kind of remain calm, you know you have confidence. If you practice these types of maneuvers, you will get more confidence, and you'll be able to handle these types of difficult situations better. So after he has an acting out episode, you want to make sure you get out of there after you block the hit or the kick, or you get out of the grab. Go to your nurse, go to the nursing station, get some of your caregivers together to try and develop a plan to get your client into kind of like a private space that's away from other residents in your workplace, or usually it's going to be inside of his room. And then when he's inside of his room, he can have time to calm down, or what we call tension reduction. So when your client is calmed down, you also have to remember to go back to your client and reestablish communication, which we call therapeutic rapport. Go back, talk to your client, start to develop trust in your client again. So he's going to trust you the next time you provide care to them. Very important for the caregiver to go back and have that therapeutic rapport with their client after an acting out episode. Usually after that, caregivers kind of sit down and analyze what happened with their supervisor, what exactly was the incident that occurred, and if you can figure out what caused it, which we call the antecedent, it's going to make it much easier for you next time if you can kind of figure out how to prevent what occurred or what caused your client to have the acting out episode. Makes it much less likely for that thing to happen again. So try to remember some of those techniques and tools. Always remember to stay calm and confident as a caregiver, because you're there to provide effective care for your client, and your confidence will show through with the care that you do provide them. Hope that's helpful. Remember to like, share, and subscribe. And I'll talk to you next time on JoJo the Caregiver Show.